Hormone receptors are going to open you up for, of course, hormone medicine. It's going to block those hormones. So there's a variety of different drugs that fall into that category. Of course, chemotherapy is on the table no matter what your cancer type is. It's going to work better in the HER2 categories and the triple negative categories, but it can work in the ER/PR positive categories as well. ER/PR positive cancer, HER2 negative, is going to be opening for a new drug, which is the targeted therapy cyclin-dependent kinase inhibitor, a CDK inhibitor. And these drugs are brand new. They're super expensive, but they really help to make the hormone therapy more effective. And I've been on one of those drugs for about 22 months. About $12,000 a month is how much it costs, but you can't put a price on life. And they certainly are really helping to increase the efficacy of some of those hormone medicines. HER2 positive disease can take a number of targeted therapies that in some cases can even be curative in the metastatic setting. These are drugs that basically go to that HER2 receptor and turn it off. So about 20% of breast cancers are HER2 positive. These drugs are phenomenal. In fact, the unique thing about Herceptin is one of the oldest drugs dealing with HER2 positive disease, is that it was actually tested first in the metastatic setting. So this is 1998, and patients that were on this trial had to have active disease. And I know several patients that were close to death when they started this drug, and they're all still alive. Some 18, 19 years later with terminal breast cancer, and have had no active disease the entire time. So if you test these drugs in the metastatic setting, it really can help everybody and be something that doesn't just help early stagers, but also the people that are in the metastatic setting. Triple negative breast cancer, we'll see ER/PR negative, HER2 negative. These breast cancers respond better to PARP inhibitors. It's the new drug class that basically splits the DNA down the middle, and basically breast cancer or cancer cells can't repair themselves. So PARP inhibitors are really something that are starting to take off, especially in the BRCA1 and 2 mutation scenarios. PIK3CA inhibitors and mTOR inhibitors are another growing drug class with the triple negative variety that are helping provide a little better quality of life for these individuals as well. When your only options are chemotherapy, it becomes really a big quality of life issue, and certainly not something that people want to be on for a long period of time. Toxicity is a lot higher in those situations as well. So the pathology report shows, here's your treatment options based on your cancer personality, and then you are able to go through and use those other tests to make decisions about how to best go